vena cava on the right side of the aorta. It begins at the fifth lumbar vertebra by union of the left and the right common iliac veins. This is the aorta running vertically in front of the anterior longitudinal ligament of the vertebral column and ends below at the lower border of the fourth lumbar vertebra by dividing into right and left common iliac arteries. The aorta gives off so many branches. At this stage of dissection, note the testicular arteries. This is the right testicular artery. This is the left testicular artery. They arise from the anterolateral aspect of the aorta at the level of the second lumbar vertebra, close to the renal arteries. The right testicular artery crosses in front of the inferior vena cava and continues downwards and laterally on the psoas major muscle, where it crosses over the ureter. This is the ureter. Then the artery runs along the lateral side of the external iliac vessels till the inguinal ligament, where it crosses over the termination of the external iliac vessels to enter the deep inguinal ring together with the ductus deferens. The artery is accompanied by the testicular vein, which is the continuation of the pampiniform plexus. The vein begins at the deep inguinal ring and ascends on the psoas major to end in the inferior vena cava on the right side. This is the end of the right testicular vein in the inferior vena cava. This is the left testicular artery running downwards and laterally over the surface of the psoas major muscle. Below, it runs deep to the descending colon and then continues as the right testicular artery. The testicular vein ascends along the side of the artery but ends above in the left renal vein. This is the inferior mesenteric artery, which arises from the front of the aorta and descends downwards and to the left to cross over the left common iliac artery, where it becomes the superior rectal artery. The superior rectal artery continues downwards in the medial limb of the sigmoid mesocolon to reach the rectum. The superior rectal artery is accompanied by the superior rectal vein, which also crosses over the left common iliac artery. Here, the ureter lies on their lateral side. Thus, the left common iliac artery is crossed by three structures, which are the superior rectal artery, superior rectal vein, and the ureter. The superior rectal vein becomes the inferior mesenteric vein, which ascends more vertically, not in company with the inferior mesenteric artery. but some distance to the left. It ends above in the splenic vein. Note that the ureter runs lateral to a vein on each side. On the left side, it runs lateral to the inferior mesenteric vein, while on the right side, it runs lateral to the inferior vena cava. The inferior mesenteric artery gives off the left colic branch above and the sigmoid arteries below. This is the left colic artery, which runs to the left in front of the ureter and psoas major, and divides into ascending and descending branches. The ascending branch ascends to the left colic flexure, while the descending branch descends to anastomose with the sigmoid branches. These are the sigmoid branches, which run to the sigmoid colon in the lateral limb of the sigmoid mesocolon, where they anastomose above with the descending branch of the left colic artery and below with the superior rectal artery. This lower anastomosis is poor and is called surgically as Sudik's point. This is the right psoas major. This is the genitofemoral nerve running on the anterior surface of the muscle. Note the ureter as it crosses over the nerve. The nerve ends at the inguinal ligament by dividing into two branches, femoral branch and genital branch. The femoral branch, which descends into the thigh just lateral to the femoral artery. The genital branch enters the inguinal canal to supply the cremaster muscle. This is the left sympathetic trunk running along the left side of the aorta and along the medial border of the psoas major muscle. It continues downwards deep to the left common iliac artery. It gives off branches which descend in front of the common iliac artery to join those of the opposite side to form the superior hypogastric plexus. This is the superior hypogastric plexus in front of the promontory of sacrum between the two common iliac arteries. Note that the right sympathetic trunk is not visible because it runs lengthwise behind the inferior vena cava.